and I am an active nurse and currently employed at St. Michael's Medical Center in the city of Newark. Thank you, Senator Vitale, for sponsoring this important piece of legislation, and thank you to the members of this committee for taking the time to hear this bill. It's been 10 years since this bill has been introduced. The fact that we are discussing it today is truly historic. So again, on behalf of the 5,000 nurses and healthcare workers represented by Genesso, thank you. As others before me have explained, we are here to express our support for the Senate Bill 1183 and to respectfully ask for the bill to be updated. After 10 years, this bill must reflect what research has demonstrated are the most effective ratios to provide the standard of care that New Jersey residents need and deserve. It must have ratios based on research. It must have an acuity system to allow hospitals to meet needs, and it must have the enforcement mechanisms to ensure that the intentions of this legislation can in fact become a reality. In its current form, this legislation acknowledges that we need baseline staffing standards by hospital unit. Right now, New Jersey has some hospitals that meet or come very close to meeting the ratios that are considered the best practice for patient outcomes. These are hospitals that are putting patient care first and are still thriving businesses. And then we have some hospitals that are operating behind the curve, falling out of step with what we know are the safest and most appropriate levels of staffing. This simply cannot continue. We need parity. The research is clear. Time and again, studies have demonstrated that there is a direct link between unsafe registered nurse staffing levels and increased patient complications, poor outcomes, high readmission rates, and even mortality. In fact, for every additional patient added to a nurse's workload, the likelihood of an inpatient death within 30 days of the admission increases by 7%. Yes, 7%. It's frightening to think that our children